Hello, my name is Kelly Ryerson from the University of the Incarnate Word in San Antonio, Texas. Today I'm presenting my conference proceedings entitled Process Improvement Initiative in a Physician-Owned Medical Practice, a Pretest-posttest Study. Currently, less than 50% of all medical practices in the U.S. are still privately owned. U.S. healthcare is in fact a profit-driven industry. But vertical integration is changing the face of U.S. healthcare. Vertical integration is good for hospitals and hospital systems, not physicians and patients. In order to avoid hospital acquisition, private practices must be able to reduce inefficiencies, maximize revenues, and improve their administrative processes. Vertical integration has multiple negative effects. Patient satisfaction decreases, physician satisfaction decreases, and the cost to both patients and payers increases. The current research in this area is largely focused on hospitals and hospital-owned clinics. Some of it is focused on patient outcomes, some is focused on process outcomes, and some is focused on patient and process outcomes. This case study seeks to propose a means to help privately owned medical practices to avoid hospital acquisition by reducing inefficiencies, increasing revenues, and improving administrative processes. This case study of a large privately owned multi-specialty group, ABC Sports Medicine, provides an excellent example of a private practice that would like to stay private. They have multiple locations, they're highly profitable, they've been in business for over 20 years, and they have both partner physicians and employee physicians. They have multiple revenue streams, including ancillary income from surgery centers, durable medical equipment, X-ray and MRI, and injections, among others. A high-level practice review identified areas for a potential process improvement initiative. One question that was considered as a potential area for a process improvement initiative was in regards to office visit coding of patient visits. Are some physicians undercoding patient office visits, which would lead to lost revenue? Office visits for either new patients or existing patients are coded level 1 through 5, with the majority of visits coded a level 3 or 4. The difference in coding levels has to do with the complexity of decision-making involved, the time involved, the number of body parts, the need for additional testing or procedures, or the need for additional interventions, and the amount of documentation required. Each of the physician's patient office visits were reviewed to determine what percentage of their office visits were coded at each level 1 through 5. It quickly became apparent that some of the physicians were undercoding their level 4 office visits. This would mean that a patient visit that should be documented and billed at a level 4 was instead billed to a level 3. In 2022, for Medicare patients, this coding error would lose between $37.92 and $55.72 per patient per visit. Correcting these coding errors could increase practice revenue by over $75,000 a year per physician. Once it was determined that a coding-based process improvement initiative was the appropriate intervention, a comprehensive review of all of the coding for patient office visits was conducted. Benchmark coding percentages for each level were established. This was done through looking at fourth quarter office visits as well as first quarter office visits and coming up with aggregate percentages for those. This was done to avoid any kind of outliers because the fourth quarter is typically the busiest quarter of the year and the first quarter is typically the slowest quarter. Potential undercoding was identified. The intervention that occurred was that the data analysis was presented to the physicians in April of 2021 in a presentation done for the practice. The limitations of this study include that there was only one practice involved. The study only looked at office visit collections. The study did not include any sources of ancillary income. The study did not cover any other healthcare providers like physician's assistants or nurse practitioners. It was not powered to reach statistical significance, and therefore it is not generalizable to other practices. The results of this study, however, were very encouraging. 2 years after the intervention was presented to the physicians in April of 2021, the data was reviewed, and 2 subsequent quarters, a fourth quarter and a first quarter, Q4 of 2021 and Q1 of 2022, were compared to the benchmark baseline numbers and found that 9 of 12 physicians increased their coding of level 4 office visits for new patients, and 7 of 12 physicians reduced their coding of level 3 for new patients. Additionally, 5 of 12 physicians reduced the coding for level 3 existing patients while increasing the coding of level 4 for existing patients. All 12 physicians' coding percentages moved closer to the best practice percentages. The expected outcome of this progress is an increase in practice revenue based on the correction of coding anomalies. Multiple recommendations exist for future research. Within this particular practice, numerous other interventions were identified that could be the focus of future research, largely focused around the ancillary income sources. Additionally, it is recommended that this type of intervention be implemented in other practices and the results be quantified and compared to see if process improvement initiatives could in fact help either improve revenue, reduce costs, or both in other private practices. Research opportunities exist for process improvement in multiple areas, including addressing call center patient allocation, addressing physical therapy referrals, addressing phone system issues, and even standardizing the script for the call center. So there are many ways that processes can be streamlined and the management of private practices can be made more efficient. Largely, administrative burden is the deciding factor when a practice decides to sell to a hospital system. So by reducing administrative burden, it is possible that it will help some of these practices decide to remain privately owned. Thank you for your attention.